Good afternoon, everybody. Welcome to the fourth seminar of the autumn term, organized by the Institute of Research into Superdiversity. As there is quite an interest in today's topic within the University of Birmingham, this session is jointly organized with Department of Economics and also supported by the Clean Air team of the Institute of Global Innovation of the University of Birmingham. As widely known, poor air quality in the UK has been estimated to contribute to around 30,000 deaths per year and to increase the incidence of conditions for many illnesses. However, the distributional impacts of pollution and the associated risks are well understudied in the UK. Especially little is known about the environmental inequality gaps between different ethnic groups. Therefore, today's topic is focusing on environmental inequalities, health outcomes, and their impact on across ethnic groups. This is on top of our research agenda, so please get in touch if you have any ongoing research or projects. We are interested to hear from you. We have three distinguished speakers. We are very pleased to welcome Professor John Fairburn from University of Staffordshire, Dr. Daniela Fecht from Imperial College London, and Dr. Katya Nicodemo from University of Oxford. Before I hand over to Matt Cole to chair the session, I would like to mention that this seminar is recorded and it will be available on the IRiS YouTube channel and our blog, which is superdiversity.net. So thanks for joining us, and floor is to you, Matt. Thank you.
Great, thanks, Joan. Right, welcome everybody, good afternoon. So I'll be chairing the three talks we've got lined up. So can I ask the speakers please to aim to talk for 20 to 25 minutes. Can I ask if you have questions, please write them in the chat and we'll try to get to them at the end of each talk, okay, rather than going as we go through. And can also ask please, if you're not speaking, to mute your microphones. So great, over to you then, John, please, with our first talk of the afternoon. Thank you.
Okay, thanks very much, everyone. There's my Twitter handle. I'm very active on Twitter and LinkedIn about air quality if you're interested. But let's go on. So I had a chat with Daniela, who's going to follow me as speaker, so that we're not doing too much overlap between each other. So I'm going to talk, or we're going to cover things like the history of ethnicity and pollution, issues of procedural and distribution justice, some of the problems of trying to do research in this area, which Daniela is going to largely cover. I'm going to introduce a little tool in case you want to work, and I'm also going to make some reference to some of the other big projects in this area that are currently going on. But first, about the different types of pollution, and Daniela is going to talk a lot more about different sources of pollution. But what we wanted to do for you was just to show how you can divide it up into three main areas, really, as a source of pollution. So probably the biggest area of research is in ambient air pollution. That just means the air around you, the kind of general situation, which gets pollutants from all sorts of different sources, and Daniela will talk you through. I'm going to look a bit at what the research from mainland Europe says from a review I did for the World Health Organization. And Daniela is going to look in depth at the UK and Netherlands from a big study that she did with a big team. I'm then going to talk a little bit about point source pollution. So these might be incinerators, waste to energy plants, factories, and that's work from a parallel piece of work I did with the WHO, which was carried out by a colleague in Rome, a team in Rome, so to see what we're saying about the links between ethnicity and point source pollution. And then we've thrown in as well that there are other sorts of pollutants. And Danielle is going to give you a case study of noise, which, to be fair, often links to air pollution, that she's carried out in London again with a team. So those are the three main big ones. Little bit of history about this. This all really kicked off in the 1970s in America. It was very much tied to the civil rights movement and the churches. There was a couple of big studies that were important in talking about the inequalities and the dumping of toxic waste in these areas. So this was back in the 1970s, and through campaigning through the 70s, the 80s, and the early 90s, we've got here a photo of Bill Clinton in 1994 passed a presidential order. And you can see there the people who are involved with that. So this is a long-term thing. It's still going on, as you can imagine. Things got better for a while, but actually then once Trump came in 4 years ago, been really bad ever since, to be honest. So here's 1994 order by Bill Clinton. It actually established an Office for Environmental Justice. It looked across government departments to make sure they were looking at these things, and it had money to support it as well. How effective it was is a big matter of debate, but the fact is that there was a mechanism there. And I think one of the reasons why this is important is because in the UK and European context, we really didn't start looking at this issue until right at the end of the 90s, the early 2000s in general. There was one kind of pulled together study by the EU in the mid-90s, but that was it really. So at the end of the 90s in the UK and the Europe when this really started to be looked at. Now, environmental justice or environmental inequalities, depending on how you want to describe them, tends to be split into two areas. The first is the area where I've concentrated on, and these are distribution studies, where we're looking at what sorts of populations get what sorts of environments. So where is the pollution, where is the clean air? And the second area is procedural justice, and this involves issues around the decision-making process about how sites will go to certain areas, who's involved, the data that's available. Since we started in the UK, these processes have been able to operate in either way. So, for example, back in the early 2000s, the Environment Agency commissioned me and a few other researchers to do a distribution study, and then they used that to develop their procedure. But sometimes it's been the other way around. People have started to think about these things and say, well, what do we actually know? Let's commission a distribution to get some understanding. So it can go either way. Ideally, what you'd want it to be would be an ongoing process if you're doing equity monitoring, and I'll come back to that. Why should we be doing it in Europe or in the UK? Well, one of the main reasons, I suppose, is the 6th Ministerial Conference on Environment and Health. This is also known as the Ostrava Declaration, which was signed in 2017. And I've pulled out for you here 2 quotes from that Ostrava Declaration that was signed up to 4 governments across Europe by the EU. So the first bit talks about equity, social inclusion, and gender equality in our policies on the environment and health. And the second one specifically targeted at indoor and outdoor air quality for all, because it's, well, it says as one of the most important environmental risk factors. Probably most people would agree it's the most important risk factor, environmental risk factor in Europe, if you look at the numbers involved. And also the second part of that quote talks about the continuous process of improvement for air quality, because the cleaner the air, the less morbidity and the less mortality we have. So this is why we should be doing it, because we've signed up to it as a government. Another long-standing procedural aspect is what's known as the Aarhus Convention. All these conventions are known after the place they were signed generally. This has been around for, I think, 20 plus years. There's a lot of countries that signed up to this. And again, it covers two aspects. It covers the issue of access and public participation in decision making, but it also covers the issue of getting a hold of the data. So these are the procedural and distributional aspects we can look at. So I'm going to talk a little bit about distribution studies and what we're trying to do and why it's sometimes difficult. What we're trying to do is put together different data sets that have been collected by different people at different periods of time, for different purposes, at different scales, in different formats. Okay, now epidemiologists would probably say that's what they do all the time. But it's a tricky thing to do because we have issues of formatting, the age of the data, scale, even getting hold of the data. Daniela's going to talk a bit more about this in her talk. But the point I'd make is that in the vast majority of studies, we're using secondary data. We're not collecting primary data. We're using secondary data and the limitations that go with that. And by combining these, usually in a geographic information system, a GIS, then we create some new meaning. At least that's what we try to do. So I'm going to talk, this is part of a piece of work I did with the World Health Organization. And there was 3 parts to it. There's references to this at the end you can have a look at if you're interested in environmental health inequalities. And I'm going to cover a couple of the systematic reviews that we looked at. So the first one is the one I led on, and this is ambient air quality, a systematic review. We're looking at all sorts of pollutants, and I've listed some of them there. Looking at original studies between 2010 and 2017, because 2010 had been the signing of the Palmer Declaration, or 2012, I think. But we had the data. We had done this previously for 2010 and backwards. So we're looking at the 7 years. This is carried out in 53 WHO European countries. That's what we're trying to find. Okay, so what did we find? How could we characterize this? Well, I suppose the first thing is there's an enormous amount of heterogeneity in the studies, both in terms of the spatial unit being used. So you could have from a postcode, which is about 15 households, up to country level and everything in between. We've got ecological studies, cross-section, panel data. We've got a very wide range of classification of population into different sorts of cohorts across the countries. And we've also got multiple multivariate analyses used as well. So incredibly diverse, heterogeneous data set. Here's the first set of results. This is showing you studies, and ethnicity is on the top line. This is showing national or international studies where the entire country is covered with subnational data units. So the entire country is covered. There's not many countries that can do this in Europe. Different parts of the UK can do it. The Netherlands can do it. Parts of France can do it, but not at a very good resolution. And I'll come back to that as well. Now, you can see here, when we looked at these studies, we can only find 2 studies that looked at ethnicity in this way. Now, Danielle is going to cover her study in her talk, but here is the other study. This was Germani et al. In 2014, looked at the Italian provinces. Descriptive results suggested that there was a negative link between Asian population and inequality, and a positive link between the African population and inequality. But when the multivariate analysis was carried out, then that relationship fell away. And Danielle will probably talk a bit about why things fall away with confounding and the rest of it. To be honest, the big issue here almost certainly was the scale that it was being carried out at. It was being carried out at a regional scale. And the problem with carrying things out at a regional scale is you get a massive smoothing of data, which reduces the differences between different areas. They could only do it at provinces, though, because that was the best data they could get. There's a big problem with a lot of data in Europe. The next one, and this illustrates it, in fact, this results. These are ecological studies that have been carried out at the city or regional scale. These are by far the most common type of study in Europe because that's the data they've got, due to whether it's federal status, such as in Germany, or other sorts of devolution or whatever. The vast majority of European studies have been carried out at the city or regional scale because they do not have enough national data sets that can come together to analyze this. We can see here there's 2 studies specifically looking at ethnicity. Most of the studies, many studies looked at education. Vast majority are looking at indices, especially indices of deprivation. That's the most common sort of analysis, and there's good reasons for that, which we can talk about. So what did those studies find? As it happened by chance, all of those studies were looking at nitrogen dioxides. So in Madrid, we find that Asian and Latin American immigrants, there was a positive relationship with them and nitrogen dioxide, but a negative one for African and European immigrants. In the same study, when they looked at Barcelona, there was a positive relationship with all immigrants. And then you can see for the other study in France, there's a time element to this. So for example, the issues seem to have gone away, maybe it got cleaner in these cities in the 2006 to 2009 time period. But before that, Paris had a relationship between immigrants and pollution, Marseille didn't, Lille did, and it was not significant in Lyon from the study that was done. These last studies here are studies that are using individual level of data. The majority of these, not all, but the majority of these tend to be studies on pregnant women or women who've recently become mothers. So they're having medical checkups as part of pregnancy, and they're part of a monitoring program. So you can get very good data with that a lot of the time. They often record a lot of cohort type data to classify the mother as well. So we've got, you can see in the top line again, we've got, I think 5 studies, and we've got a bit of other information. And if we do that, what do we find? Well, in Valencia, non-Spanish mothers were more likely to have higher levels of benzene. In Switzerland, for PM10, foreign nationals were more likely to have higher levels. In Valencia, for another study, mothers from Latin America, higher levels of NO2. But in the Asturias, no relationship with ethnicity. And in these 3 areas, in another study, no relationship with ethnicity again. The main findings from the study found that it was deprivation that is most strongly linked to different sorts of pollutants across the whole study. Ethnic minorities, they experience a mixed exposure, depending in part on which ethnic minority you're talking about. Because again, I suspect, and Danielle will talk about this, you get sometimes confounding. So you get ethnic minorities in different classes, different socioeconomic position, and that tends to be the more determinate factor from what we can see. But these can all come together. So we find that, you know, there is often an overlap between deprivation and many ethnic groups. So I suppose one of the recommendations which has come out of this is that Europe has seen a massive improvement in inequality over the last 20 years compared to what it was 20 years ago. And those improvements have come through largely universal approaches. So getting cleaner cars on the roads, moving over to cleaner fuels, smokeless zones, all sorts of stuff. But the inequality has actually increased in some cases, in many cases. And what that suggests is that if we want to tackle those remaining areas, we're probably going to need targeted policies, whether targeted by population or targeted by area, especially in cities. Here's a little bit about the study to show its strengths and limitations. There's a problem. The studies are dominated by countries from Western Europe. You know, that is a big problem. Many of the studies are cross-sectional or were one-offs. They're being done by interested academics. They're not being done as routine monitoring. No studies in many of the countries. And then even amongst some of the papers, poor specification, poor reporting on variables, poor reporting on results, even some poor use of air quality data, if you ask me. So that is the ambient results for across Europe, basically. There is cause for concern with ethnicity, but there's an even bigger cause for concern with deprivation. If we now look at point source pollution from across Europe, these are, I think I've got about 5 results here which tie specifically to ethnicity. You can have a look at Passetto's work. A small study in Hamburg found a link between higher toxic release and proportion of foreigners. A national study in Germany found the same thing in terms of exposure to industrial pollution, what are often called IPC sites. And in France, a link between higher unemployment and immigrant levels. Another one in France, finding that foreign-born communities, this one's really interesting because the relationship was still there even after controlling for deprivation and population density. And then another one done in France, which said, well, things were different afterwards or not so different afterwards. That's all in the paper there. So on the whole, if we pull together the evidence we've seen so far, we can say that there is cause for concern for ethnicities, both in terms of ambient air pollution and in terms of point source pollution, but there's probably an even bigger concern about deprivation, okay? Now, if you're interested in this thing, this is another tool that came out. So if you want to do something about this or you want to know something about this, this was a tool that I developed with some colleagues at the World Health Organization. It's aimed at people tackling environmental inequalities, but I think if there's academics on here, you'd find it very useful, particularly for your postgraduate students, because we pulled together a lot of information into a compendium. It'll save you a lot of time finding it. Different chapters. So if people are completely new to this, we go through, okay, how do you do a distributional analysis? Generic advice that you can think about covering this. We've also pulled together a lot of the tools that have been developed in this area of work. So if you want to see work that's been done by the World Health Organization and others about why this is important, you can have a read of that. And there's also a big appendix at the end. It's not a big document, but there's a bit at the end to say, okay, if you're this type of person, if you're a citizen, start here. If you're working in a local authority, start here. If you're a policymaker, start here. Another big project that's been going on and which is coming to its conclusion fairly soon, I think, was led by Professor Alice Marr at Warwick University with a team there. This was funded by the European Research Council, so very prestigious. They're very difficult to get grants. I think it runs for about 4 years. They've just published this book, but there's a massive amount of stuff on the website, mainly a sociological approach, but genuinely global. Case studies from right across the world. And there's the book there if you want. The other big project that's still going on at this time is
sorry.
Horizon 2020 project. It's still running, and this is logging campaigns and injustices right across the world. So you can have a look at that, and there's a massive team on that as well. Some resources here. So the paper I talked about, a blog where I put this stuff, the toolkit. So I think the organizers are going to make this presentation available to you if you want it, or get in touch with me, but they should be making it available to you after the talk. Co-author details of my systematic review, and then feel free to join me on LinkedIn. I'm on Twitter. I run that includes an equality list that I run on Twitter. So that's got a lot of people from NGOs to global policymakers. If you want to look at that equality list, and if you want any of my publications, you can get them from this link here, or they'll point you towards where they are. So I think that's about 25 minutes, Matt.
Yeah, that's perfect. Thank you very much, John. Really good review there. Right, we've got a couple of minutes for questions. We are really conscious of time, but does anyone like to ask a question? I noticed none have appeared in the chat. Has anyone got any burning questions, or I can ask one if not? No? So John, one issue, so some of these studies show that it's or hints that it's a deprivation effect really, but often we see once deprivation has been controlled for, we still find an ethnicity effect. So the $1 million question, I guess, is what's driving this in your view? Is it overt discrimination in the siting of polluting facilities? Is it a sorting effect in terms of job choice of certain immigrant groups, or what is it that's causing this inequality?
It depends on which country you're in, to be honest, and what type of pollution you're talking about. So if we look at, say, point source pollution as an example, part of the problem we have in America and that we've had in Britain is we've got what's called a grandfathering approach in many cases. And what that means is that if a site has been used for a pollutant activity for a long time, it often is allowed to keep polluting there, and often people will look to put the site, to put the resource there, or to expand that site. So those communities that have been living next to a polluting site for decades then get another one. So grandfathering is part of the issue. There's an argument that is made about that this is a kind of sorting effect through the housing market, by which wealthier people move away from polluted areas, and so poorer people are left in the poorer environments, for example. And it really does depend if you're talking about ambient air pollution or point source pollution as well. I think if you look at Britain, a lot of ethnic minorities are concentrated in the biggest cities, and they're concentrated. And in fact, if you map the index multiple deprivation and then you map ethnic concentration, you'll see a substantial overlap. And the problem or the issue there you get a huge amount of traffic coming through those areas or into those areas and passing out and bringing the pollution with them. I mean, there's parts of London, for example, where the vast majority of households do not own a car, and yet you have some of the highest levels of pollution in England. To the person in the chat, what about England? Daniela's going to cover that in the next talk in a minute. So it kind of it depends which pollution you're talking about, which country you're in as well.
So thanks. The question about legal status, I guess we're talking, these are mainly based on census data, I guess, a lot of these studies.
Yeah, I haven't gone into that because I think Daniela might, but when we're talking about ethnicity, what do we mean? Well, the definition has changed over the years, the official definition. It tends to change in each census, and it has again. In other countries, they often use the the status of the mother, for example, to identify immigrant populations as well. So it can be a legal status, but other times it's often coming from the census data.
Okay, great. I think we'll have to end it there, but thanks very much, John. Really good,
Okay.
really good talk. Okay.
Over to Daniela.
Yes, over to Daniela now. Daniela, are you able to share your screen? Great. Over to you then, Daniela, whenever you're ready.
Thank you. Can you see my screen all right?
Yeah, perfect.
Yes, you can, yeah.
Thank
Perfect.
you. Yeah, so as John has indicated, the work I'm presenting is focused mostly on England. But, sorry, there you go. And I'm also going to talk about air pollution mainly, but I'm also covering noise pollution, in particular noise generated from traffic. I'm going to talk a little bit more about those interactions between ethnicity and socioeconomic deprivation that we often observe. And I'm going to highlight some of the limitations that we often encounter in those studies and potential solutions for that. So, but before I start, I would like to take a little bit of time to talk a little bit more about what do we actually mean when we talk about air pollution, because air pollution is a very broad term which captures a wide variety of pollutants which come from many different sources and have very different spatial patterns. So I think understanding a little bit more about the spatial distribution of pollutants might help in interpreting some of the findings, in particular the inconsistent findings that some studies report. So in the broadest term, air pollution are gases, solids, or liquid contaminants which are emitted into the atmosphere from various sources, causing harm to pollutants, but also can damage, for example, plants or materials. And if we talk about pollution, there are two main different groups of pollutants. So the first one is what we call primary pollutants, which are directly emitted into the atmosphere from a specific source. And a good example herefore is, for example, car exhausts. And I highlight here fine particulate matter, which is one of the primary air pollutants of concern. And there are also what's called secondary pollutants, and these are pollutants which form in the atmosphere due to chemical processes with other components. And one of them, for example, is nitrogen dioxide, a gas, which forms a very complex relationship with nitrogen dioxide, oxides, and ozone. So these are due to processes which happen in the atmosphere. And if we talk about particulate matter is a summary term for particles in the air, which come from many different sources. They can be from natural sources such as wildfires or sandstorms, or from anthropogenic sources such as combustion engines and so on. And you can see on this slide here, they are very, very varied in size. And the size really matters because the smaller the particles, the deeper they can penetrate into the respiratory system, and then from there go on in the bloodstream where they cause various health effects. And if you look at the distribution of particles, you can see there is what we call a global component, and that might be something from really far traveled sources such as sandstorms, for example. We have a regional component, which in the UK mostly comes from Western Europe. We have an urban component, which you see as a sort of dome shape here. And then we have very localized sources such as roads, industry, or construction. And all those different components together they create the air pollution that we model or measure on the ground. So if we look at this picture here, which is for each postcode in London, estimated PM 2.5, in the graph, which is sort of shows the concentrations across this transect, you almost sort of see a replica of this dome shape distribution, and then you see the local spikes. So you can see, for example, this big spike here, which is around the Heathrow area. And then you can see other spikes, central London, which is across the main roads. But in general, what you can see is that you have a sort of higher concentration in the center, and then they decrease as you go further out. But in addition, you have those very high local concentrations. And if we now look at nitrogen dioxide, which is much more driven by local sources, you can see that the global and the regional component is much smaller. So if we look at a map of nitrogen dioxide, you can see it's much more driven by the main roads. Again, you can identify Heathrow Airport here, for example. If we now talk about traffic noise pollution, so we look at noise from road traffic, and you can see here it's a fairly linear relationship going away from the roads, and then you have what we call noise barriers, such as houses, which might shield you from noise exposure. We talk about railway noise, which acts in a similar way, and you can again see the sort of linear relationship here. And then if you have houses, for example, or other noise barriers in the way, that sort of shields you from that exposure. And we talk about aircraft noise, which has, because it's overhead, so it's not impacted by noise barriers, so you get a much more area level exposure to aircraft noise. And these different patterns result in very different sort of spatial patterns in those two pollutants. So if we look at a PM 2.5 again here, so we saw this very sort of almost smooth pattern away from the center. But if you look at noise, and this is from road traffic, you can see it varies a lot. And it varies, excuse me, it varies very greatly if you go away from the main road. So if you now imagine that many of the studies we conduct are at the area level, where we average the exposure across a small area, you might see that we might capture quite well the PM 2.5 concentrations, because we will identify higher concentrations in the center and lower concentrations as we go out. But for noise, for example, if you imagine we have an area here and an area here, they give you very similar results. And that's also the reason why often noise and air pollution is not as highly correlated as you might imagine, given that both of them originate mostly from road traffic. So looking a bit more closely at what we mean by environmental inequalities and why it matters in terms of health. So as John has shown, evidence suggests that some parts of society, such as the deprived ethnic minorities, but also certain age groups, are exposed to different levels of air quality. And that's what we usually term environmental inequality. But inhabitants in those areas might be especially vulnerable to the negative health effects of air pollution, and that might be due to underlying health conditions or their social circumstances. And that's when we start talking about triple jeopardy. So we have some communities which experience higher air pollution exposure, and it's these communities that might also be more susceptible to the negative effects of air pollution exposure, which then results in likely greater health effects from those exposures. And that's something which we've seen in many studies across the world. So looking at a little more detail in some of the work we have been doing. So the first study I want to look at looks at associations of air pollution and ethnicity and deprivation across neighborhoods in England and the Netherlands. And our research question here was, is the burden of living in neighborhoods of high levels of air pollution spread evenly over the entire population, or are some demographic groups more burdened than others? And then coming back to something that Sean mentioned earlier, we really try to understand if these associations are the same across different countries, across different cities, and also across different pollutants. So in this study, we focused in England and Netherlands, and the reason was that we had air pollution model, which was air pollution maps, which were modeled using the same, in this case, a land use regression model. And you can see the maps here for NO2 and PM10. And that's a very high resolution. So we had this data at 100-meter resolution. And we aggregated this data to what we call neighborhood level. So in England, that is represented by the lower super output areas, which have an average population of 1,500. And in the Netherlands, there is a comparable geography called Burton, with an average population of 1,450. And on the maps here, you can see the different study areas or scales that we analyzed these neighborhood associations at. So we looked at the national scale, we looked at individual regions, and we looked at various cities, which are shown here in red across the two countries. And we were interested in differences in ethnicity and differences in deprivation. And coming back to the question earlier about how do we define ethnicity, in this case, we used a census data for the UK, and we defined ethnicity using the percentage of non-white population within a neighborhood. And the reason why we could not differentiate between different ethnic groups was that as soon as you go outside London and some of the other inner city areas, England is very white. So you don't get enough contrast in ethnicity to do analysis broken down by different ethnic groups. In the Netherlands, we had no information on sort of ethnic groups. So what you used there was, again, from their census, the percentage of non-Western immigrants. And in both countries we used as a deprivation measure, we looked at income deprivation. And just want to highlight some of the results. So these are mean air pollution concentrations by socioeconomic status and ethnicity. And in general, we see for both pollutants, PM10 and NO2, higher concentrations in the most deprived quintile compared to the most affluent quintile. And that is the same across all study areas and cities. You can see here, for example, for NO2, quite strong differences between the most and least deprived areas. And the differences in NO2 are higher than for PM10, even if you take into account the different magnitude of the pollutants. And if you look at cities like London, for example, you see that you have up to 8 micrograms per cubic meter differences, which is a lot. If we look at ethnicity, we see that areas which have more than 20% non-white have higher air pollution. The same for England. And I think it's very interesting to see that across the whole of England, we see a vast increase in air pollution levels in the most deprived areas. But that's not necessary the same for each, for all the cities. So if you look at Liverpool here, for example, we see a fairly similar levels. So if we, in a multi-level analysis, we adjusted the socioeconomic variable for ethnicity and the ethnic variable for socioeconomic deprivation, and you can see that for the socioeconomic patterns, so we still see about across the different quintiles that the highest deprivation quintiles has higher air pollution concentrations, but this is not as strong as in the unadjusted or the descriptive results, but the effect is still the same for ethnicity. So even after adjusting for this deprivation, we still see that very strong or very much higher levels of air pollution in more deprived, in ethnic diverse areas. So just to sort of summarize our findings, so we've seen that associations between air pollution and those population characteristics differ between cities and countries, which has important implications in terms of transferability of results to different settings. The differences were more marked in urban areas compared to rural areas. And as mentioned before, NO2 is a marker for traffic-related exposure. So any policies to reduce inequalities should really focus on transport-related measures. And that's particularly important if you start targeting certain areas to introduce control policies and so on. The second study I want to talk about is at an individual level study. And in this study, we looked again at air pollution and noise in London, but I want to focus on the noise results here. So one of the limitations, as John said, if we look at individual level data, is often that we don't have the data for a large number of people. So for this study, we used information from the London Travel Demand Survey, which is conducted by the Transport for London, which surveys approximately 8,000 households per year on a rolling basis to represent a random sample of households across London. And we used data between 2006 and 2010, which gave us around 40,000 individuals after excluding individuals which did not have demographic data. So because we had this individual level data from the London Travel Demand Survey, we could use self-reported ethnicity, and that was self-reported as either white, Asian, Black, or other. We had information on household income, and we also looked again at the area level deprivation using the same income deprivation from the index of multiple deprivation as previously. And we had the residential postcodes of each of those individuals in the survey, so that's how we linked the area level data and also the exposure data. So here's an example of the road traffic noise data, and you can see in this little map here, we modeled air noise pollution for each postcode centroid in London, and you can see again similar patterns to what we saw on the map, very high concentrations or very high levels, very close to the road, and then as you move away, they decline quite steeply. And we used a model which adapts the calculation for road traffic noise method. We also looked at a railway and aircraft noise, and we identified all postcodes which were within a 50 dB noise contour from overground railways and Heathrow Airport. And those data come from DEFRA. So if you look at the mean road traffic noise, you can see that the households with the lowest income had the highest exposure to road traffic noise, which is very different from if we look at aircraft noise from Heathrow Airport, where we see that the highest percentage is in the most affluent group, or the group with the highest household income. We identified Asians as the ethnic group which is exposed to the highest levels of road traffic noise, while Black ethnicities were exposed more to railway noise. And then if we look at the area level indices of deprivation, again, for railway noise, we see that the highest deprivation quintile is exposed to the highest levels. And that's also seen in the final model, where we sort of predict the probability of exposure. And you can see that for Heathrow, there's almost a negative relationship with exposure to aircraft noise and household income, while we don't really see a sort of clear pattern for railway noise. And then if we look at ethnicity, and for Heathrow Airport aircraft noise, we have the white ethnicity is with the highest exposure, while for railway noise, it's Black and other ethnicities. So overall, as a concluding remark, we've seen very complex patterns of socioeconomic and ethnic inequalities, which makes it really, really difficult to disentangle the effects of those from ethnicity and those from area level deprivation. And there are some sort of hypotheses that might explain this sort of effect, and we might want to talk about those a little bit later on in the questions. And we also see different patterns if we look at individual compared to area level measures. So in another study, which is not shown here, we showed that even affluent areas, affluent individuals living in an area of low socioeconomic status are obviously exposed to the same exposures. And all of this has really important implications for targeting environmental inequality, because you really have to understand what you're dealing with and the sort of different components of what defines inequalities in order to target intervention strategies and consequently tackle health inequalities. Thank you very much.
Great. Thanks a lot, Daniela. That's really good. Right. We've got like 5 minutes left for questions. Would anyone like to raise a question? You don't need to type it. You can just unmute yourself and ask it if you like. Okay. So the ecological fallacy problem's been raised there. Yeah. Any comments on that contrast between individual level measures and area-based measures?
Yes. So I think what we have to remember in all of this is that we're not really measuring individual level exposure. So you might see, if you look at personal exposure, which is what an individual experiences over the day, so which is influenced by travel patterns, occupational exposure, and so on, that might be very different to the ambient air quality, for example, which is measured at home. And we did another study where we sort of started looking at that by modeling personal exposure depending on where someone works and the likely mode of travel there. And we saw that the individual level and the area level might potentially be very different. But again, that's a completely different sort of layer of complexity, which is added to what's already been shown.
Sure.
Daniela, I'm interesting also because I think that immigrants tend to live in the area that are usually more crowding area and also the cheapest one. So it's possible to eliminate this effect from your data? So the fact that it's also come by the fact that maybe they use very old cars, or there are a lot of people that work in that area and so on. So it's not just ethnicity per se, but it's the neighborhood where they are clustered.
Yes, I think that comes back what Sean said earlier about the sort of the history of the housing stock, and where the housing stock, and we're talking about cheap housing, high density housing, is usually based in areas of former industrial areas with historically very high levels of pollution. I think we have to be careful not to sort of put the blame on the people themselves, because again, as John said earlier, it's you know, some of the areas in London where most of the air pollution is generated from cars coming from outside the area. And then you get this sort of what's termed the environmental justice component, that the people generating the air pollution are not the ones who are exposed to the air pollution as such. And but yes, I think another thing which is sort of very interesting, which is sort of we tried to get it in one of the first paper I described, where we adjusted for socioeconomic status, was that even as individuals from ethnic minority, they sort of, you know, they are they could potentially afford to live in better or less polluted areas, because of the sort of community spirit, they choose to live in areas where you know, where their family is or where their community is. So that might be a factor contributing to those patterns that we see.
Great. So there's a couple more questions there. So Bowen Liu, it's my PhD student, is asking about the pollution measured at monitoring station. I mean, this is modeled background maps, pollution maps, aren't they, rather than actual measurements and monitoring stations, I guess.
Yeah, so yeah, they're based on models, but the model is based on measurements taken at the monitoring sites, and it also accounts for local sources. So it's not just background, but it incorporates traffic density, for example, the proportion of heavy goods vehicles, and so on.
Yeah. Okay, great. So I think we should leave it there. It's now 2:30. Thank you again very much, Daniela. So now, Katya, are you able to share your screen, Katya?
Yes, I try to.
Now taking us in a slightly different direction, away from pollution itself to more occupational risk and differences in that across ethnic groups.
I think
Katya.
I cannot stop. I try to, yeah. Quit unexpectedly. They told me that to quit unexpectedly don't sound close. Okay, try again. Screen to share. Can you see my slides?
Yes, we can now. That's great.
Okay. I don't know why my computer is very slow, but I try to put this in format that everyone. Okay, great. I think, can you hear me also? Yes.
Yes, we can't see you.
Okay.
We can hear you.
It's, I don't know why it's disappear my video, but anyway, okay, it's, you can see my picture anyway. Okay, I don't know. I can see here. Okay, I think now it's fine. So thank you very much for inviting me. This is a great opportunity, and I think it's a really an important issue, especially these days that we can see that there is huge inequality between immigrants or certain ethnic groups and COVID, for example. So I think it's really important. So here today, I talking about this is work that I'm starting to looking more or less 4 years ago, where we try to see the effect of immigration on native health, and in particular, we look at in this paper, we look at the injury at work. This is a joint work with Katerina Alachevich in Oxford, who are, both of us are in the Department of Primary Care in Oxford. And we talking about here Italy, and so we have data in Italy, but we have done a couple of work also in UK, where we see, first of all, the immigration on waiting time, the effect of immigration waiting time in UK, and after we have another paper also published really that look at the immigration and effect on health and on native health in the UK. The difference that all of in UK it's a little bit complicated sometimes to study these topics, because we don't have really good data. Most of them usually come from survey, and the administrative data usually they don't record the information about migration. There is some information about ethnicity, but when we're talking about migrants here, it's more complicated. So what we're looking here, there is seems that there is this grow evidence of injury rate gap between migrants and native. Usually these migrants tend to have an injury rate higher than the natives, and usually work in these 3D jobs, so dirty, dangerous, and demanding. And there is starting a grow literature in this topic. So if we look here, the natives and the immigrants, this is the injury rates. We can see the injury rates. Usually this is goes down for all European countries, the injury rates, but the natives, of course, have less injury rates than migrants. When we see the share of immigrants that came to Italy, of course, there is this huge spike after the 2013, and again, we can have these injury rates goes down. Now, the literature on immigration is quite controversial. So someone tend to tell that the immigrants usually have a negative effect on natives in terms of wage and employment, and we have this paper of Borjas and some other evidence for UK. So an alternative hypothesis is from Perry and Ottaviano and so on, that were to tell us that there is this, a kind of composition effect between immigrants and natives. So natives tend to shift to less manual intensive occupations, and immigrants tend to take these jobs that are more highly physical demand. And so this is reallocation can have an effect on the on native health. And we proved that in this paper with Giuntella and Vargas, where, for example, in UK, we find that there is a reallocation on the occupation. We use the LFS in that paper, and we find that there is this reallocation that make the natives really reduce the physical burden. This is more or less the theory here. What we contribute here, well, if there is this allocation, we can also see that if there is some effect on the injury at work. Injury at work is really important because it's really costly for the governments, and also this is one of the big policy in Europe to reduce this accidents that you can have at work. So first of all, here we have a variation on the number of immigrants that we have across province in Italy over time, and our identification strategy is again this independent effect on occupational change. So what we find here, the injury rates goes down more or less. If you increase 1 percentage of immigrants in a province, you reduce 11% the injury rate. We find also that the severity of injury, so the sick leave days, goes down on natives. And this is especially true for all the natives workers above 50, 65. Most of this is effect occur in three big industry like manufacturing, industrial and construction sector. So about the channel also here, we try to figure out why this is come from. And we find that immigrants tend to select themselves in the tasks that are more risky and they have more physical intense. And there is a composition change in the workforce where immigrants push to the employment high educated people, and this could explain what our funding. When we're talking about migration here, is something that this is foreign born people, but also people that immigrate usually for economic reasons, and so we don't take in account asylum seekers. So one thing that we need to consider here is the fact that sometimes usually most of the time immigrants are self-selected, so they are young, the natives, and also in better health. This is an important issue because when you compare these people, you can see that there is a difference between these migrants and natives. So the data that we have here come from the Institute for Employment Injury Rates, that they collect all of the work-related accidents, and we have the data from 2009 and 2017. We have all the information about sector, the degree of impairment, the province, the demographic factors, and so on. Of course, we can miss these immigrants that are illegal, for example, that can have an accident and are not reported. Usually, if this is a fatal accident, of course, there is jail for the employer, but of course, it could happen that we miss some of these people here that have some work accident and they don't report because they are illegal. So we have information about age, province of residence, country of birth, and the sex. And we, for the foreign born, we have this data from 2009, 2017, but we take in account also the data in 1990 to create our instrument variable for our, because we want to control endogeneity here. We also use the labor force survey for the employment sector, the activity, the province, and demographic that help us to understand the mechanism that could explain what we find. So we restrict the ages to 1665. We have more or less 91 province. It was 109 by the year, change across here. So if we look at the sick leave days and the degree of impairment by sector, we can find that native is on the have a disease more sick leave than the migrants, and this is also for the degree of impairment. So although and we can see later that immigrants usually have high injury rate, what we find here that the sick leave is higher for native and the degree of impairments too. And of course, the primary sector, the sick leave days and the impairment is higher for the respect to the secondary and the tertiary sector. We're talking about 30 to 35 days, more or less, for natives, around 32 for immigrants when we're talking about sick leave days, and around 2% of the degree of impairment here. How is our empirical strategies? So what we look is the severity of injury here, and for a worker I in province P in time T, And we look at just the native, and we have the share of immigrants in that province in time t. We have the province fixed fact. We have the labor market. So we consider the GDP, the unemployment, that province, and other factors. And we have also some characteristic of the workers in that period. So we look at the age and so on. And gender, and we control for other variable. This is could be two variables that we measure. The first one is the number of sick leave days prescribed by the doctor, assigned when you have an accident, and also the degree of impairments that also is determined by the law. And so one of the concern, of course, is that this variable here could be endogenous, so it's correlated with the error term, and so we need to control for that. We to control for that, we use these shift share instruments. And so we consider the number of immigrants that were residents in province P in 1999, and we impute with these instruments, we impute the number of immigrants in that area, so the share of immigrants in that area, and will be our instruments here. There was some caution here because there is this Jega paper and McKenzie in 2018 that probably the shift share immigrant is not a good instrument, so could be some problem of exogeneity. So to test that, we do two more things. So use the lag of instruments. So we have the lag of 3 years of instrument, and we also use the share of 1990. So we avoid all this kind of issue that could be a problem when we look at the exogeneity in our analysis. So for example, the move on the entering the European Union, and also the enlargements of EU in 2004 and 2007, for example. So this is our first results here. So what we find that if you increase the migrants share for natives, especially if you focus on column 3 and 4, that is our IV analysis, we can find that there is a reduction in the number of days, more or less is 3 days and a half. And also there is a reduction in impairment, around 10% of impairments you will reduce if you increase the number of share of immigrants here. So we also look at this immigration native work injuries. So the injury rate seems not to have an effect, although this is negative. The sick leave, so the probability to reduce sick leave is decreased, and so this is also the probability to look at the impairment will decrease. So which are the mechanisms behind that can explain these results? So first of all, I didn't present here the table bar in my paper. So if you want the paper, just send me an email. I'm happy to forward you. The first one is a change in native employment rate. So if we use the LFS, and we can see that when we increase the number of immigrants, so 1% increase in immigrants in that area, there is a change in the employment rate about 2.5%. So there is more people enter in the labor market, and usually what we find, who are these people that enter in the labor market, are usually people with high education, so especially with tertiary education. So, and this could explain the fact that these people, that the new people that enter in the labor market, maybe they study and they decide to enter in the labor market, have a more ability, and so also they move versus jobs that are less physical intense and also less risky, especially if they have a higher education level. We also find that when we look at these OP index and ONET index, these are indexes to calculate how physical is and how risky is the occupation, and we can find that the migrants tend to have a higher index of risk and physical in the occupation respect to natives. So it seems that there is a shift of natives in the less risky or risk type of job. So also, what we found here, and this is we cannot really to tell too much about that. Seems that there is a Pareto improvement. So migrants, although they have a higher injury rate, what we find is the severity of work-related injury is less, and also so the impairment is less. So this means that although the immigrants also we control for the characteristic and so on, they have less severity of work-related injury, and this is could come by fact that they have self-select from the original country, and so could be these Pareto improvements that they can find if we compare this respect to the original country here. So about the conclusion here, so we have the immigration usually lower injury rate for native workers. So this is something that it's quite new, and also is quite important the moment that when we're talking about immigrant and talking about the possibility to enter or not in a country, we need to thinking that there is some benefits, although of course, there is also some negative effect of immigration, but this is a positive effect on natives' health. Immigration also, when they although they are selecting these 3D jobs, so this very high demand job and a very high risk job, we can find that the severity goes down for them, and so there is some issue to explore more why this happen. It's not the skill here, but could be something else that make this is happen. So again, the physical intensity is higher for migrants, and this issue should be in the future a problem if we thinking, okay, maybe the injury rates now it's not a problem for them, although it's higher than native. Maybe in the future could be a problem because, for example, they can maybe needs more medical resource or something that in the future. So their health, we can see this is in other countries that usually the immigrants when arrive they are healthy than native, but with the time they tend to have the same level of health of native. So we found that immigrants have no effect on any unemployment, but they tend to increase the employment rates of natives, and this could be a challenge that can explain this. Now, of course, there is limitation in this study, and one limitation is the fact that we don't have employee data. That with much with injury data, this would be fantastic. We have tried in Italy to match this employee data with the injury, but there is no possibility. In UK is impossible. We have tried also to have injury at the administrative level, but they told no. So it will be good to have these longer horizons, so follow this course of individual and see what's happened across years here. We have done not in a panel way, but it could be interesting to see, for example, this cohort, they have injury already, what's up in the future in terms of healthcare service. I think I stop here. So if you have any questions or you want the paper and so on, or discuss something, you can send me an email and I'm happy to send to you.
Great, thank you, Katia, very much. So we've got a couple of questions straight away, which look quite related, really. So could immigrants still be attending work with injuries due to fear of being dismissed? And are immigrants less likely to ask for sick leave, in your view? I guess both of those could be quite possible, couldn't they?
Sorry, say again. If the
Could immigrants still be attending work with injuries due to fear of being dismissed and maybe not receiving sick pay?
Yeah, it could be a possibility. Yes, of course, it could be that you have a very should be not a very dangerous injury, because of course if you cut your arm you cannot work. But I don't know, if you have just a small injury like back pain or something like that, I think this will be easy happen to back to work and not look at the sick leave. Yeah.
Do we know statistically whether immigrants are less likely?
There is no really statistic on that, because this is not reported like illegal immigrants, how many injury have illegal immigrants and how this is the fact. We don't have any statistic on that really.
Yeah. And does your data include informal immigrants?
Just the formal one. So, well, could it be include also illegal immigrants if they, for example, have a high injury and you go to the hospital, you need to declare how to do that, and automatically the hospital will contact this employer, because, for example, if they don't do that, there is a high risk for the employer, because this is quite strong law in the sense that you jail straight away if you have some accident and you didn't report that.
Okay, so has anybody got any further questions on this talk? Feel free to chip in either on the chat box or just to ask a question. Perhaps you could stop sharing your screen now?
I'll try. Yes, I think, yeah.
You. I mean, any general comments on any of these talks now, then let's open it up more generally. I mean, one question, Katia, I guess it's a fairly general question, is which are the most high-risk sectors in your data, or occupations, I should say?
Construction and agriculture, these are the two ones that are quite, especially the primary, and sector, it's the one that most danger. Yeah.
And would you expect the results that you found for Italy to also hold in other European countries? I guess there's nothing.
Yeah, there isn't nothing at the moment that we can compare. We have compared with this paper that we have in UK. We use the lab for survey really, but I cannot find other papers that try to. Well, in Spain, I think there are some data too that we can explore, but. Yeah, the idea would be good to use this administrative data matching with the employer to see which employer is more high risk, for example, and maybe try to understand why this employer are high risk and they have high injury rates, and where they, in which sector, which area of the country, all these things. Yeah.
Okay, so we have a question saying our results are fairly obvious. Isn't the more important question, why is this allowed to go on? The role of macroeconomics, okay. I'm not quite sure what the role of macroeconomics is here in particular.
Yeah, we control here for the GDP, we control here for unemployment rates, so that can have an effect. For example, if you have high activity in one area, maybe this is also increasing the number of injury rates. So we control for that really. Of course, so we find the area that are like Lombardy, that it's the area that you have more high activity, also have more high injury rates, and this is something correlated with that. But we try to control for this macroeconomic condition, yeah.
So I was wondering what the kind of overall scale of this is in terms of lost productivity, just to give us a sense of, you know, how big this issue is. You know, you've got obviously lost people losing work days, Can you give us a sense of that?
Yeah, no, we have tried to calculate this because it was, I don't remember now the number, but I remember that UK has attached number to lost in terms of sick leaves, injury, and so on. And if I don't remember correctly, it's around £6,000, depending on type of injury and the severity. So per worker. So more or less, it's quite high number there, especially where the mortality it's the huge one, right? This is the fatality accident are the worst one, but they attach a very high number to in terms of loss of productivity. And there is this I don't remember the name of the England for the injury rates that they control that. So they have done some calculation on that, and it's quite high number really.
The number for air pollution is 20 billion a year. Fairly recent, one of the government agencies study.
Okay, yeah.
And obviously quite, well, huge across all of Europe as well.
No, yeah, I remember that there is also a report in Europe. I think we have done something in my paper, but I don't remember now. Because of course, do an envelope calculation is not easy, really.
Any further comments or questions about any of our talks now, and to any of the speakers?
Can I ask another one then? Yeah, so just on the kind of big picture question, you know, you kind of wonder, can you ever eliminate inequality, in a sense that, you know, if there's some kind of sorting going on, people, kind of the richest people move to the nicest houses, that kind of thing. So I guess the big picture question I had is, you know, so we can kind of document inequality, but to what extent is it just a question of kind of benchmarking that over time, or, you know, how does policy proceed from here?
Well, I can start with that if you want. Policies proceeded in a couple of ways in different countries. So, for example, in parts of America, when they did the distribution study, and this was particularly around the Boston area, they designated certain communities environmental justice communities, and they said, whatever happens next, whatever dirty use is going to come along, wherever it goes, it's not going in here. So that was one, because the planning system is key to dealing with this. Secondly, when I did the work in Scotland, which really shocked them in the levels of inequalities, what they said was, all right, you've identified a really big problem and we're going to have to think about what we do here. But as a starting point, we've created a £2 million fund, which will be targeted in these communities to get them involved with the decision-making process and to work with those communities. So, and then a third one would be Forestry Commission Scotland. When I did work up there, they were already concerned that they weren't hitting the deprived areas before I started to analyse it for them. And my work, or our work, showed that actually they had been successful in targeting grants in the most deprived areas for their new woodlands that they wanted. And if you look at the use of the IMD over the last 20 years or so, particularly under New Labour massively used the IMD to target resources in those areas that needed it most because of deprivation. So there has been billions has gone into allocation of resources using the IMD, for example.
I would like to add on that as well. So I think it's a sort of philosophical question, what we as society decide is a fair way of handling those inequalities. So is it that, you know, equal distribution, that each individual should be exposed to the same levels? Or are we saying that, you know, people who are healthy and are less likely to experience those really strong health effects, should they carry the highest burden? So should we really protect the vulnerable and then move, you know, polluting sources, as John just said, to other areas? So I think it's not so much what should we do, but I think it's the sort of what as a society do we think is a fair thing to do.
Sure. I just kind of to follow up that, you know, you kind of always worry about these things that the kind of the market operates in a way that, you know, if you make an area better, then yeah, if you're a homeowner there, great, your house value goes up. But if you're a renter, then, you know, you maybe get squeezed out to another place. So it kind of just pushes people around a bit. So I know it's not kind of definitive that's going to happen, or we don't know the extent of that, but obviously there's some kind of risk involved if you kind of make something better in one place, then you know, prices respond.
I think, I mean, it is like that in a way, but if you look at London, for example, and that's the same which has been shown for cities like Rome or Toronto, where the most affluent people live in the highest pollutant areas, such as Belgravia and Mayfair. But it's very difficult to analyze what that actually means, because those people, you know, might spend the weekend away in the countryside. So what is actually coming back to what's the actual exposure, I think is relevant here as well.
There had been a couple of questions privately about the definitions used in the studies. Maybe it's a good point to raise. So using ethnicity as a measurement, unit of measurement, rather than, for example, migration, would change your results, or how would that influence in the UK or in Italy? In some countries, we know that we don't have ethnicity data collection, like in the Netherlands, for example. So how do these definitions change the outcomes?
I think the definition is really important, and it doesn't just relate to ethnicity, but it also relates to a socioeconomic status. And I think there was an earlier comment about how would those relationships change if we look at an individual level versus area level. The problem we can only conduct studies using the data which is available. And I think that is really sort of the limitation here. And I think, you know, the most comprehensive data still comes from the census, and we can really only work with what we have available. But I do agree that those sorts of aspects are important to consider.
Yeah, I agree with Daniela that the problem is that in UK we collect usually ethnicity, right? But a person that live 3 generations, it's and you say, okay, this is, I don't know, Pakistan or Black African or so on. It's not the same if they are British in any case, right? And so it's really, I think the results change, at least in my case, I can find difference if I use ethnicity or country of birth. And change a lot, because it's not the same if you arrive and you are migrants of first generation or second or third generation, really, where you can learn the system and you can move around England quickly, right? Instead, if you are first generation, you can have problem with language, problem with the system, and so on. And this is really impact on the population. But it's a hard. I agree with Daniela. It's really hard to find data that could be help us to understand a little bit better this issue.
Okay, I'm conscious we're losing the audience and 2 of our speakers now already. I think it's now time to wrap it up, folks. So I've lost 2, as I say, but I'd like to thank them very much anyway. And thank you also, Katia, for a very enlightening talk. So thanks all for joining us. Very important issues, very timely issues, and very stimulating. Thank you indeed very much.
Thank you very much. Take care. Bye-bye.